Setting general practice. You're a nurse here. A parent comes to see you with his 4-year-old son who got an injury with a rusty nail while playing in the garden. He needs to have the tetanus injection, but the parent refuses to have it. Now let's see the task. First one says, find more details of the incident. Second one says, explain the treatment, clean and test the wound, then importance of tetanus injection. Third one says, explain the child needs injection immediately, deep wound, foreign body's presence, and he did not take the tetanus vaccination as part of the childhood vaccination program. Fourth one says, explain the importance of tetanus vaccination and warn him about the potential risk of tetanus. Fatal disease causes seizure, muscle stiffness, lockjaw, and difficulty in breathing. After giving the injection, explain the rare and mild side effects: feeling achy, tired, mild nausea, or lightheadedness. Now let's get into the role play. Hi, good morning. I'm Oliver and I'm one of the registered nurses working in this general practice. You look so worried today. What is bothering you?
Nurse, good morning. I'm a little worried about my son who got an injury on his hand with a rusty nail today morning.
I'm really sorry to hear that. Try not to be worried. We are here to support you. Moreover, I appreciate you for contacting us for medical assistance. How may I address you for a better communication?
You can call me David.
Thank you, David. Can you please tell me what exactly happened to your son?
Sure, nurse. He was playing in the garden today morning with his friends. Unfortunately, he got an injury from a wood which had some rusty nails in it. I don't know how it happened.
Okay, David. I know it must be really stressful for you. Can you please tell me your son's name and age for the record, please?
He's Adam and he's almost 4 years old.
Would you mind if I examine your son's injury for a better understanding?
Sure, nurse.
Based on my examination, I could see that the paper and I can see the presence of foreign bodies over there. But do not worry, I can clean the wound and dress it properly. In the meantime, can you please let me know if he has ever taken any tetanus vaccination as part of his childhood vaccination program?
No, nurse, he has never taken any tetanus vaccination before.
I'm really sorry, David. Your son needs tetanus injection immediately. Can I proceed to take it now?
Sorry, nurse. Why does he need the vaccination? What happens if he does not take the tetanus vaccination?
I understand your nervousness, David. However, your son needs the injection immediately because his wound is a little deeper and there are chances of foreign bodies along with dirt. Apart from that, he did not get the vaccination as part of the childhood vaccination program. So, he is unprotected from tetanus. So, the vaccination is necessary right now. So, can I proceed to take the injection?
Okay, nurse. Can you please let me know what is tetanus?
Okay, David. I'm glad to explain in detail what is tetanus, its symptoms, and its complications so that you can understand the seriousness of the condition. Tetanus bacteria can infect the body through broken skin, usually through injuries from contaminated objects. Tetanus bacteria are more likely to enter the body through breaks or wounds in the skin. This includes wounds contaminated with dirt or spit. Once the bacteria enter inside the skin, they multiply and produce a toxin or poison that affects the body. I hope you understand me, David.
Yes, nurse, I understand it now.
Now let me explain you the symptoms of tetanus. The most common signs of the infection is tightening of the jaw muscles. Moreover, it causes seizure, muscle stiffness, lockjaw, and difficulty in breathing. As I told you before, tetanus is fatal and it can lead to serious health problems, including being unable to open the mouth and having trouble swallowing or breathing. Therefore, vaccination and good wound care are extremely important to prevent tetanus infection. Apart from that, being up to date with your tetanus vaccine is the best to prevent tetanus. Therefore, it is highly important to take the tetanus vaccination right now. Are you following me, Mr. David?
Nurse, I was not really aware of these complications before.
Okay, David, no worries. Your son is now safe and an immediate vaccination is really necessary. I reassure you that your son will be perfectly alright. So shall I proceed to take the vaccination?
I completely understand the importance of injection now. You can proceed to take this vaccination.
I appreciate your good decision, David. Thank you for your cooperation and understanding. Okay, David, the vaccination is done now successfully. Do you have any more questions for me?
Nurse, will there be any kinds of side effects after this vaccination?
Your worries are completely understandable, David. Yes, there will be some sort of side effects after taking the tetanus injection. Please set your mind at ease. Sometimes the tetanus vaccine can cause mild side effects. This may include soreness, redness or swelling at the site of the injection, fever, headache or body aches, fatigue, loss of appetite, lightheadedness. But do not panic. These side effects will disappear shortly. If the side effects persist for a long time, you can consult the doctor immediately. Do you have any more questions or concerns, David?
No, nurse. Thank you so much for your support so far.
It's good to hear that, David. Now let me summarize what we have discussed so far. Until now, we have discussed regarding your son's injury with a rusty knee and importance of tetanus vaccination along with its side effects. I hope I was able to clarify your concerns. Now please relax here. I'm going to make some arrangements to test this wound. In between, if you have any questions or concerns, you can ask me. I will be glad to assist you. Thank you, David, for sitting your general practice. I wish you a
Thank you, nurse. Thank you very much.
Thank you all. Our role play. And see you.